Hello, welcome to the module titled Energy and Health in the Built Environment. In this module, we are going to talk about a topic that influences our lives more than anything else. A topic at the center of attention of all governments and institutions, the private and the business sectors, and of course, all families and individuals. Imagine while sitting right now watching this module, the screen turns off. The light turns off. It's dark. You feel cold. You try to turn on the heater, you cannot find it, and when you find it, it's not working. No energy, no light, no connection, nothing. Complete energy blackout. For 1 hour, for a day, for a week. This is just one out of many examples of how energy influences every second and every day of our lives. And we wonder, is there an actual solid and verifiable relationship between energy, health, and the built environment? And if so, how would this relationship be? What would its characteristics be like? Would it be constant or inconsistent? Would it be positive or negative? And if it can be negative, can energy be the cause of a severe health issue, a critical disease, or even death? Well, this is what we are about to discuss in this module. Did you know that the buildings and the buildings construction sector combined are responsible for almost 40% of global final energy consumption and even carbon emissions? Do you know that more than 80% of this energy production is accounted by fossil fuels? Can you imagine the scale of something like that and its impact on global warming and climate change, the challenge of our century, with all its influences on the environmental and social determinants of health? Things like clean air, drinking water, soil, and of course, secure shelter. Global warming and our state of health are strictly connected. For example, extreme high temperatures are a main contributor to deaths from cardiovascular and respiratory diseases, especially among older people. Pollen and other aeroallergens which trigger asthma are much higher in extreme heat, affecting around 300 million people globally. This is 5 times the population of a country like Italy. Can you imagine the magnitude, not to mention natural disasters and the numerous losses they cause every year? One of the World Health Organization assessments estimated that by the year 2030, climate change can cause up to 250,000 additional deaths every year. The most vulnerable groups are people that live in coastal regions and small island developing states, mountainous and polar regions, and finally, people that live in mega cities. This is why international bodies and global movements like the United Nations, the World Health Organization, and the European Healthy Cities Network are acting actively to enhance the reduction of greenhouse gas emissions with a list of associated co-benefits for health. And of course, cities are at the front line of this action. For example, shifting to circular urban metabolisms, transition to cleaner energy systems, promoting safe use of public transportation and active movement, and supporting energy efficiency in buildings. These are the strategies at the center of the climate change and health transformation agenda. National policies must define clear emission reduction targets, enhance investments in energy R&D, and encourage cities to complement these targets with applicable policies and efforts at the local level. For example, cities can provide solar maps with information on energy yields compared to their installation costs and payback periods, which obviously vary based on the location, the neighborhood, the building itself, and so on. Stakeholders and citizens will invest in energy efficiency and earn at the same time. Energy efficiency can have significant economic advantages. And speaking of cities, locations, and neighborhoods, how we move within our cities, how we commute, how we travel from one point to another has a fundamental impact on our environment and on our general health. For this reason, it is important to reassess our mobility patterns and transportation systems and integrate innovative ways to use them as a tool that induces environmental and personal health benefits. It is time to adopt transport systems and technologies that reduce our reliance on oil and fossil fuels. Public transport, in combination with cycling and walking, can lead to major reductions in air pollution, noise pollution, energy consumption, traffic congestion, and even improve road safety. Did you know that traffic deaths by cars represent almost 50% of transport fatalities? This is in a country like France, where road deaths by cyclists represent less than 5% of total transport casualties. But these figures are not any different from other European states, where roads are considered to be the safest in the world. So imagine the scenario in other places, where the state of road safety is even lower. A mobility system that is safe, healthy, and sustainable should encourage two things: the adoption of soft travel methods or non-motorized transport means. This includes rollerblades, roller skates, and so on. And the switching between various transport methods. For example, taking the bicycle to the train station and then taking the train to your destination. Or walking to the bus stop, taking the bus and then getting off to use the bike sharing system, and so on. This kind of behavior generates regular physical activity as a part of our day-to-day life, which also influences our state of mental well-being. Therefore, the design of our built environment, our transport systems, and our open spaces today has to integrate physical activity safely and easily into our daily routine. Also, great health benefits can be achieved in the housing and regeneration sector through a mix of measures. For example, home appliances are closely connected to our comfort and well-being, especially with the new possibilities brought up by the smart home technologies and their implications on indoor air quality, health monitoring and support, especially for older adults, on safety and security, and on energy efficiency and consumption, such as reducing space heating, which represents about 60 to 80% of consumption in most European homes, mostly dominated by fossil fuel-based equipment. So according to the International Energy Agency's Sustainable Development Scenario, the share of clean energy solutions has to exceed 50% of new heating equipment used by the year 2030. Also, the building morphology and the building envelope characteristics play a key role in heat flow and total energy demand of a given building. For example, effective envelope retrofits is a well-established tool that can provide lower energy demand and lower reliance on mechanical acclimatization while reducing carbon emissions. It can increase indoor comfort levels, reduce pollution, and even stimulate financial benefits. An effective use of active and passive natural ventilation strategies is necessary for a healthy house. It can reduce mold and damp, provide fresh air, and of course provide cooling effects, especially with the global rise in cooling consumption trends. building energy modeling can support a holistic assessment process that guides solutions that optimize the building envelope and the whole building system's performances. Urban building energy models are suitable for analyzing urban contexts with complex energy scenarios. Future policies have to prioritize solving the problems of the existing built environment while stimulating sustainable outcomes and outputs. Today, healthy housing and regeneration should aspire to enhance the comfort and well-being of households, provision of efficient and resilient buildings, provision of outdoor spaces, and finally, provision of inclusive programs to provide improved social, economic, and environmental urban conditions. A healthy city must address energy efficiency for homes and public spaces, energy efficiency for the industry, the agriculture, the various means of transport, and for all the commercial and public services. Not to mention the health facilities. The health sector is one of the most intensive users of energy. Energy is essential to health, development, and livelihoods of all society members. Yet, energy can also be harmful to health. Methods of heating, cooking, and transport may degrade homes and community environments and have severe impacts on health, both directly and indirectly. For example, through inequalities, such as fuel poverty, through contributions to climate change, and through poor air quality. Deriving energy from clean sources is paramount. This is necessary to support climate change mitigation, to reduce pollution in all its forms, and to lower our risks from NCDs, non-communicable diseases. Do you know what non-communicable diseases are? Do you know they are the cause of more than 70% of all global deaths? Cardiovascular diseases, respiratory diseases, diabetes, and even cancer. They all are non-communicable diseases that are strictly connected to our energy patterns, our lifestyles, our natural and built environments. So, it is urgent now, more than ever, to establish new mindsets for healthier and more sustainable patterns, healthier housing, more sustainable transport, and more resilient cities for all. Thank you for attending this module.